People often come and see me following failed treatment for sacroiliac joint pain, or pain in the sacroiliac region, shall we say, with other osteopaths, physiotherapists, chiropractors. It's a common thing. That's always been the case. It's not, originally it wasn't because I was an expert in it, it's just because it's a difficult thing to treat, and so quite often people will sufferers with that sort of pain will find themselves doing the rounds trying to find somebody that can help them. Originally in the first days, I would often find myself asking the patient, so what has the other osteopath physiotherapist done? Obviously I'm thinking, well, I don't want to do the same as what the previous person has done. But quite often I found myself listening to what sounded like very good treatment. And this obviously left me scratching my head and thinking, okay, there's something not right there. And I think what I've realised over the years is there's a step that needs to go in before the treatment. Now, whether the treatment is hands-on style of treatment, working into the muscles or the joints in the area, or whether it's exercise prescription or a combination of both, those are both styles and approaches of treatment that I use and can bias towards more of a hands-on or more of an exercise prescription. That's no problem at all. But I think there's a step that often needs to go in before that sort of treatment, and it's something I wasn't taught very much at all, if at all, at osteopathy school, and that is the importance of movement patterns. When a patient comes into my clinic and struggles to sit down in the chair because of the pain in their back, because of the amount of pain they are suffering, or actually that's not struggles to sits down in an unusual way, sits down in a braced way. Often people with these sort of chronic long-term conditions start to change the way they move, and will move in a much more guarded, braced way, because they know that if they move in the wrong way, they're going to get pain. And what I've realised is that sometimes these movement patterns themselves can become major maintaining factors in the pain, and often just need to start by making the patient aware of how they're moving and looking at ways we can help them to move in a more natural way. Because if somebody's got a habit of moving in a very rigid and protective way, in a non-functional way, then you do the best treatments in the world. That's not going to change their habit that they've developed over the last 18 months of struggling with this sacroiliac pain. So they're just going to go back into the same faulty movement pattern, and it's not surprising then that things don't get better, because you've got these locked-in patterns. So it's this idea of often just treating the way the person is moving, look at some simple movements before then progressing really into the hands-on stuff and looking at whether it's, is it lax ligaments, is it inhibited muscles, is it muscle weakness, whatever the heck's going on. That stuff is all relevant and needs to be done, but if you don't put it on decent foundations of just the person moving as well as their body can allow them to move without these protective movement patterns, then you've really got no chance. So hope that's helpful. My name's Adam. I'm an osteopath here at Adjust Massage in Nottingham.